I would like to introduce our first speaker, and it's a great honor for us to have Minister Butler with us today to open the conference. Minister Butler is Minister of State for the Department of Health with special responsibility for mental health and older people. She is a TD representing the Waterford Constituency and also had the honor of being the first female Fianna Fáil TD to be elected for the party since 2007. In the 2020 general election, Mary was delighted to be re-elected to continue her work representing the people of Waterford City and County. And I'm especially happy to have her here because she's a strong advocate for all people in the state living with dementia and for their carers.
Good morning, everybody, and I am really pleased to have been asked by Engaging Dementia to deliver the opening address at its 15th International Dementia Conference. And Kim, I would like to thank you for all the work you do as CEO. I have long been an advocate for people with dementia and their families. And since becoming Minister for Mental Health and Older People, I have sought to ensure that services and supports for people with dementia and their families are available. The focus of this conference on how best we can provide dementia care in both community and residential settings is timely and very, very welcome. We know that approximately 2/3 of people with dementia live in the community and around 1/3 in residential care. And we also know that 70% of people in our nursing homes have dementia or a cognitive impairment. Here in Ireland, every day, 30 people, yes, 30 people are diagnosed with dementia, which has a direct effect on each family. With the number of people with dementia expected to rise from 65,000 today to 150,000 by 2045, it is essential that we have the right care available here, in the right place, at the right time. We know that Ireland has a rapidly ageing population, and the majority of people wish to age in place in their own home and communities. And as a government, we continue to invest heavily in community-based services to support this. I'm proud to say also, though, that Ireland has the highest life expectancy in Europe, and don't take my word for it. That was deemed by the World Health Organization. So we have the highest life expectancy in Europe. And I want to thank each and every person that works in healthcare across the country, whether it's public, private or voluntary, that go to work every day, 7 days a week, delivers the most amazing healthcare to all the people who need it. I am pleased to report that the government has made significant investments in dementia care in recent years. €2.1 million in government funding has been allocated this year to ensure that dementia daycare centres can return to full capacity in a post-pandemic environment. And I couldn't talk about dementia care facilities without our partners in the Alzheimer's Society of Ireland. We now have 46 dementia-specific day centres in operation. And I want to compliment the Alzheimer's Society for their partnership, their drive, their focus, and their can-do attitude. No matter what is asked of them, we engage, we work together. It's absolutely fantastic to have such an invaluable organisation that is providing huge supports on the ground. These daycare centres provide activities and programmes to promote cognitive stimulation, social engagement and physical activity, and importantly, they provide a break for the family carer. Importantly, funding has also been in place since 2021 for in-home dementia daycare for people who, for a variety of reasons, cannot or don't wish to attend a day centre. Given the high prevalence of dementia in people with Down syndrome as they age, the government has also funded an intellectual disability memory assessment service in Tallaght University Hospital here in Dublin, providing diagnostic and post-diagnostic support services to people with Down syndrome and their families. In terms of care at home, I am pleased to say that the proportion of new home support hours allocated to people with dementia will increase from 11% in 2022 to 15% in 2023, valued at 5.2 million. And that was my key asks for this year's budget. We also have funded 9 new memory assessment and support services and 2 new regional specialist memory clinics in locations around the country in 21 and 22. And the HSE aims to have these services operational by the end of the year. We have also agreed to resource attend memory assessment and support service in 2023. Establishing these essential services will ensure there is timely access to both diagnosis and post-diagnostic supports and a reduction in waiting times, which is really important. Recruitment for these services is ongoing, and the HSE plan to have the most of them up and running by the end of this year. We all know early diagnosis will be key in the treatment of dementia, with advances in disease-modifying therapies. Brain health interventions will also be key to slow progression of the illness and maintain quality of life. We are committed to ensuring that everyone affected by this condition has access to the care journey and the support they need at every stage of their journey. We have funded 29 dementia advisors throughout the country. These advisors play a crucial role, engaging people with dementia, their families and carers to provide free and confidential supports and signposting to help connect with essential services. And I want to give a special shout out to each and every one of these dementia advisors working on the ground in every community. Again, this can-do attitude, they support people, they support families, and they signpost to where the best supports are available. And when you get that initial diagnosis of dementia, having somebody like a dementia advisor that you can pick up the phone and ring, they can call to the house, and they just guide you through a very challenging time. But with the support of the dementia advisors, it does make a phenomenal difference. All these investments will hugely help the experience of people living with dementia. Our National Dementia Strategy contains a range of important actions to increase awareness of dementia, to improve diagnosis and provide integrated services, supports and care, and to improve education and research on dementia. The National Dementia Office was established in the HSE in 2015 to provide leadership on and coordinate the implementation of the strategy across the dementia care spectrum, and it has delivered an impressive range of projects over the past 8 years. Importantly, next Wednesday, the National Dementia Office will publish a model of care for dementia, and I'm looking forward to meeting many of the people on this call today at that event. This is a really welcome development, and the model of care outlines care pathways for people with dementia, from the identification of symptoms through to assessment, diagnosis, disclosure, care planning, and post-diagnostic support. It also sets out a range of targets and practice recommendations to ensure that people receive the care that they need in a timely manner and in a joined-up way. The National Dementia Office has conducted 2 audits of dementia care in acute hospitals, which have highlighted the need for a range of improvements in care for people with dementia. In government, we have provided resources over the past 3 budgets for the appointment of nursing specialists to improve dementia care pathways in our acute hospitals, so that people with dementia can receive the best possible care and be discharged back to the community as early as possible and as appropriate. Arising from the result of the acute hospital audits, a national clinical guideline on the appropriate prescribing of psychotropic medications for non-cognitive symptoms of dementia has been developed. It has now been rolled out progressively across acute, community and residential care settings to ensure that psychotropic and antipsychotic medications are only prescribed when needed, and that people with non-cognitive symptoms of dementia are provided with alternatives to medication when appropriate. One of the key goals of the National Dementia Strategy has been to combat the stigma and fear surrounding dementia. I am sure you will agree that much progress has been made thanks to the Dementia Understand Together campaign, which was launched in 2017 to increase public awareness of the condition and to highlight that with supports, people can live well with dementia for a long time. Through sustained funding, Understand Together has now transformed into a community movement that brings together organisations throughout Ireland to undertake a range of actions to support people with dementia and their families. I recently launched a Dementia Understand Together in community symbol, which I believe you will hear more about later today. The symbol sends a strong message that people with dementia and their families are valued and respected members of our communities, and that our communities want to support them to stay active, to stay engaged, and to be supported. I was really impressed by the work of both the partner organisations and community champions in opening up opportunities for engagement for people with dementia, who are more likely than other older people to experience social isolation. We know that staying socially active and engaged can both slow the progression of dementia and can positively affect mood and a person's overall health and well-being. Community resources like dementia cafes, dementia and career support groups, they're really, really important for both people with dementia and their family carers, as they provide information, connection, and they combat isolation. And just having that cup of tea or coffee and speaking to somebody who might be going through a similar experience as yourself really, really helps. By raising awareness of dementia in our communities and supporting people to understand how you can make a difference, we can give people with dementia the confidence to retain some of their independence and their routine. By taking both a governmental and a societal approach to dementia, and by combining clinical and social interventions, we can work together, and we do, to ensure that people with dementia and their families are properly supported, both in their communities and in their interactions with the health services and other state services. Tomorrow, I understand you will discuss the important topic of dementia care and residential care. Evidence shows that small-scale home-like living arrangements, combined with an ethos of person-centred care, improves quality of life and care outcomes for people with dementia. The CareBright Dementia Village in Bruff, County Limerick, for example, provides this model of dementia care, and it is my vision that over time we will work towards having a dementia village in every region of the country. And only on Tuesday, I met with the new CEO of the HSE, Bernard Gloucester, to discuss supports for people living with dementia, including those that will need at some stage long-term residential care. Another example of this household model of care is St. Joseph's in Shankill, where the original nursing home was remodelled into 6 smaller households. In both locations, care staff are assigned to a single household, getting to know residents' needs and preferences and assisting them to live the best life they can. Staff education about dementia is really important to ensure the provision of high quality care. It is vital that staff in nursing homes understand how to provide good dementia care. I'm really pleased to see that some of your presentations over the next 2 days will focus on sensory and cognitive stimulation for people with dementia, including music therapy, the use of virtual reality, storytelling and reminiscence, and we all love to reminisce. We know that these are powerful interventions which can really improve the quality of the care experience. Collecting data about care provision for people with dementia is important so that we can objectively measure the care people with dementia are getting, assess the improvements in care outcomes over time, and allocate resources to where they are most needed. With government funding, I am pleased to say that the HSE is developing a national dementia registry, which will gather important data on dementia assessment, diagnosis, treatment, and care. In conclusion, we know that people with dementia and their families require a range of tailored supports and services that target the different stages of their dementia journey from multiple angles. This includes support not only from healthcare professionals, but also from the voluntary sector, businesses, and the whole community. Over the next 2 days, you as health and social care professionals, together with people living with dementia and their families, will discuss how best to provide high quality care and support to meet the evolving needs of people with dementia and their families. And I want to thank each and every one of you who will speak, especially those who will speak about lived experience and challenges that you have had on your dementia journey. So for my part, as my role as Minister for Mental Health and Older People, I will continue to prioritise government supports in the years ahead. I am very proud of the fact that I was the first minister ever to embed the funding of dementia into the base of our budget. Previously, we were dependent on philanthropy, we were dependent on dormant accounts, and we didn't have ring-fence funding. Now we have, and I'm looking forward to my 4th budget to even deliver more for people living with dementia in Ireland. So thank you again, Kim, for all the work that you do. Thank you for organising this fantastic event. There will be great learnings from it today. And again, I want to thank everyone for all the work they do supporting people living with dementia in our great little country. Thank you very much.
Thank you so much, Minister Butler, for your words and for your support and your advocacy. It makes such an impact, and yeah, it's nice to know that you're there and pushing everything forward.
Thank you, Kim, and I am always here. So for as long as I can, I'll continue to do this work. Thank you very much.